Morning if you've just joined me. Now, if you've ever had acid reflux or heartburn, well, you'll know just how uncomfortable it can be. But for my next guest, heartburn was way more than that. Bradley Phelps suffered from severe acid reflux for years, impacting his life dramatically. Despite trying various treatments and lifestyle changes, his symptoms persisted. He had physical pain, mental distress, and couldn't engage in social activities due to the condition. That's until he underwent a special type of surgery, which is going to be available on the NHS in the next month or so. I'm delighted to say Bradley joins me now. Morning, Bradley.
Morning.
So a lot of people will just think of heartburn as an annoying thing that they get every now and then. But for you, tell me what it was like.
It started off fairly gradually, but it did escalate. It impacted your life so badly. You had this constant chest pain, throat pain. You got it after you ate. It was worse, so you tended to cut down on meals, and it was with you 24 hours. You went to bed, you used to bring up acid, you couldn't sleep. It was quite such a bad experience, and it wouldn't go away. There was nothing really that you could do to get away from it.
Tell me about all the things that you tried.
At first, they put me on medication. I was on that for a year or so. The symptoms came back. They put me on a higher dose and then a higher dose. But in the end, the medication just didn't work. I tried avoiding acidic foods on the basis if you don't take in acid, you won't bring up acid. I tried then to go on a bland a menu as I could, just having like bread, potatoes, avoiding anything that I thought would upset. But even then, you had the symptoms. The symptoms just were there. It was there 24 hours a day.
I can't imagine what that would do to you mentally, Bradley, because presumably you were losing hope.
Yeah, well, yes, it didn't impact just on me, it did on my family as well. Like, for instance, my wife, she felt helpless because there was nothing she could do. You avoided meeting people because your mood was so bad. You didn't see your family or your grandchildren. And I remember one day just standing in the shower thinking, I really can't see myself carrying on with this for the rest of my life. It was that bad. And that's when I started to do a bit of research online. And it surprised me how many people had acid reflux and how many people had similar symptoms to mine. And like me, they had it for decades and just were living miserable life. And that's when also it started off fairly gradually, but it did escalate. It impacted your life so badly. You had this constant chest pain, throat pain. You got it after you ate. It was worse, so you tended to cut down on meals, and it was with you 24 hours. You went to bed. You used to bring up acid. You couldn't sleep. It was quite such a bad experience, and it wouldn't go away. There was nothing really that you could do to get away from it.
Tell me about all the things that you tried.
At first, they put me on medication. I was on that for a year or so. The symptoms came back. They put me on a higher dose and then a higher dose. But in the end, the medication just didn't work. I tried avoiding acidic foods on the basis if you don't take in acid, you won't bring up acid. I tried then to go on a bland a menu as I could, just having like bread, potatoes, avoiding anything that I thought would upset. But even then, you had the symptoms. The symptoms just were there. It was there 24 hours a day.
I can't imagine what that would do to you mentally, Bradley, because presumably you were losing hope.
Yeah, well, yes, it didn't impact just on me. It did on my family as well. Like, for instance, my wife, she felt helpless because there was nothing she could do. You avoided meeting people because your mood was so bad. You didn't see your family or your grandchildren. And I remember one day just standing in the shower thinking, I really can't see myself carrying on with this for the rest of my life. It was that bad. And that's when I started to do a bit of research online. And it surprised me how many people had acid reflux and how many people had similar symptoms to mine. And like me, they had it for decades and just were living miserable life. And that's when also I came across clinics that said they could help. And that's how I got in contact with my consultant, Nicholas Boyle.
Okay, so talk me through that then. So you'd got to this point where you just really thought, this is it. It can't go on like this. You were doing your own research. I always think, isn't that a bit of a minefield when you get out there onto the internet? How do you know?
Yeah. What's
real?
On the suggestion of my wife, she said, "Go on. There may be some help out there." And that's when I came across these forums, and people some people, as I say, that had it decades. But then I found that some people have found help through going to a clinic and having, getting help through there. It's more by luck than judgment that I came across a clinic that said they deal in acid reflux. I thought, can they help me?
And that's where you went. And what were the conversations like that you had with that clinic?
Well, I made an appointment for a consultation, went down to London, and I described my symptoms and sort of said, is there anything that can be done? And Nicholas Boyle, the consultant, a very nice man, said he should be able to help. But the relief when I heard that, it was amazing.
It's incredible actually sitting opposite you and talking to you about this experience, because when we went back, it was like you were back in those times, reliving just how awful that must have been for you. But then your face lifted.
Oh, yeah,
said you could help.
Yes, yeah. You wouldn't believe how relieved I felt at that point.
It must have been mixed feelings, though, because you must have desperate to get this sorted. But this is this was very new surgery.
Yes, well, at that point, I felt I felt anything, absolutely anything that could help me in the situation I was in, I'd go for. If it could help, fantastic.
And how was it? How was the surgery? Was it hard to get over? How did it work for you?
Surprising. I went down. It was March last year, 2022. Went down. It was day surgery, but because I was in Leicester and travelling down to London, they said just stay overnight. I went down about midday. And all I remember coming up about 2 hours later, I think, and my wife was in the room. I was sitting up, and that basically was it. It was all done by keyhole surgery, so all it left was a couple of small scars, which I have trouble finding now. when I say, would you like to see my operation, it's hard to show people.
No impressive scars.
And that was basically it. And
wow.
The next morning, I was given some painkillers just in case I needed them, and went home. The only downside to that was at the time there was train strikes, but luckily we managed to get home all right. And
how's life been for you since?
Fabulous.
Really?
Yes.
How's it changed?
Well, I've got back to a normal life now. I mean, I used to have interests that I like to garden, we like to travel. You couldn't do any of that. You just stayed indoors. But now it's what we call a normal life.
You can eat whatever you want?
Oh yes. I'm a great curry lover. So anything like
Bring
that.
it on.
Spicy foods.
And I know it's okay because you said you'd had a coffee this morning as well.
Yeah, sure, yeah. But yeah, what we describe as a normal life is now what I lead.
Oh, it's incredible. And it's so wonderful to see just the smile on your face. This has obviously made incredible difference to your life. It's becoming available on the NHS very soon.
Yeah. And I'd recommend anybody who is suffered like I have, that there is an answer out there for it.
Should this cure it forever? Have you been told it shouldn't come back?
I have been told. I've talked to some people, and it's been on the continent, I think, for a little while now. And there was a case with an opera singer who actually lost her voice because of it, and she had her operation, I think, about 8 years ago, and she says she's fine. So, yes. There
we go. Well, listen, we've got your surgeon on a little bit later on. What would you like to say to him, Bradley?
Thank you very much. He's changed my life completely, and that's all I can say is thank you.
Oh, it's wonderful. It's wonderful to see you, Bradley, and talk to you and see just that smile on your face.
Thank you.
Is in such a happy place. Thank you. That's Bradley Phelps there, who has just had such a change in his life from suffering with this incredible heartburn, acid reflux for decades. And then this surgery, this groundbreaking surgery that's coming to the NHS very soon, has completely changed his life. Well, Nick Boyle was the man who performed surgery on Bradley. He's a specialist in upper gastrointestinal and a reflux surgeon. Oh, sorry, Nick, that's a mouthful. I don't think I said that right at all. Thank you so much for joining us. Now, everyone, I'm sure, will have experienced heartburn or acid reflux at some point in their life. But to that extent of how badly it was affecting Bradley, how common is that for it to be such a problem?
Well, it's a pleasure to be here. And it was really, I think, interesting to hear Bradley's story earlier on, because it is such a common story. When people think about reflux, as you say, frequently they think it's a simple, straightforward condition and you just avoid eating too late at night or suck on a rennie and everything will be fine. And of course, for many people, that is indeed the case. Perhaps 20% of the adult population in the UK will get reflux symptoms on a regular basis. But there's a spectrum of severity, and Bradley's story is, again, typical insofar as he had symptoms over many years, which gradually got worse. And his symptoms were dominating his life, weren't they? We can remember that he couldn't sleep at night because he was getting heartburn and regurgitation. And I think we as doctors sometimes are guilty of not just realizing the impact of these symptoms on people's well-being. The standard treatments, as you again said, are lifestyle measures and then antacid medications. And there are hundreds of millions of pounds spent every single year in the UK on those medications. And that gives you an idea of just how many people there are out there taking powerful drugs on a regular basis. So there's a significant portion of the population who need treatment regularly. And the final thing to say on this, I suppose, is that perhaps 20 or 30% of those people taking those pills will find they don't work very well. So they take regular medications and yet they still suffer the kind of symptoms that Bradley has. So it's a really common and I think sometimes misunderstood condition in terms of its impact upon people's quality of life.
Yeah. What causes it to be so extreme?
Well, it's usually a progressive condition, and ultimately Gastro Oesophageal Reflux Disease, which causes a variety of symptoms, Bradley had a lot of them. He had heartburn, he had regurgitation, but he also had throat symptoms. So I think he actually mentioned an opera singer who found that she had problems singing. And again, some patients can have those kind of symptoms just isolated to their throat. Ultimately, the problem is caused by failure of the valve at the bottom of the esophagus, the food pipe which takes food when we swallow through into the stomach. And if that valve fails, then it will allow acid and other things from the stomach to regurgitate up from the stomach into the esophagus and even into the throat. And as the failure of that valve worsens, then people will experience increasingly bad symptoms. And that's the general story. I think it's also important to point out, Joe, however, that there are lots of other conditions which can present in similar ways. And that's probably one of the reasons why some of those people taking pills find they don't work, is because they're very often given these powerful PPI, proton pump inhibitor drugs, on the basis their symptoms are secondary to reflux, and sometimes they're not. So it's really important to get the right diagnosis before you can decide exactly what the right treatment options are.
Well, Bradley did his searching. He found you, and then he found this surgery. So it's called Reflux Stop. Talk me through it. How does it work?
Yeah, well, just if I can just go back to the diagnosis bit first. He came to Reflux UK specifically because that's what we specialize in. So he went through a series of tests which allowed us to identify that, yes, he had definitely got reflux, and that, yes, his symptoms were caused by the reflux. And then he had a series of options as to how he wanted to proceed. And there are now many interventions, including surgery, which can make a really big difference. Now, in his case, his symptoms were so bad that he was prepared to go through an operation. And I think, again, it's another misinterpretation of the reality that very often people will think, well, surgery, that's a big deal. That's a massive thing. And that's based upon historical procedures. So we've been doing anti-reflux operations for decades, but historically they were really big and they had many side effects associated with them. But modern procedures are quite different. Now, Bradley decided to have Reflux Stop, which is a relatively new procedure, and it has the advantage that you're not wrapping anything around the food pipe. So in principle, people should suffer little in the way of swallowing difficulties after surgery, which can be a problem after some of the other operations. And in particular, he had slightly poor strength of contraction in his esophagus. So he decided to go for Reflux Stop. And as he said, it was a day case procedure. We actually kept him in hospital overnight because he was the second person in the UK to undergo the procedure. So we were just getting used to doing it ourselves. But we've now done 25 operations ourselves, and our results are really promising. It's important to emphasize it is a new procedure, so we do need to await long-term studies to validate our initial feelings. But certainly the patients that we've treated so far have done really well. They get over the surgery quickly, so now we do send everybody home on the same day, and they take a week or two at most to get over the surgery. They do tend to suffer minimal problems in the way of swallowing, and the vast majority seem to have really good outcomes. And I was looking, when I knew that we were going to have this conversation, Joe, I was looking back at reminding myself of Bradley's story. So we ask everybody at Reflux UK a series of questions which are specifically designed to quantify, to assess just how bad their symptoms are affecting their quality of life. Well, when I first met him, he scored 55. And if I tell you the average score of people undergoing surgery is 25. So he was really suffering badly. Well, when we last asked him to let us know how he was doing a few months ago, because we do obviously keep an eye on everybody, we follow everybody up, and he scored 0. So for him, the operation has been a great success, and that's very gratifying.
If I could just go back to this thing, because I'm fascinated by this. So Bradley was only the second person in the UK to have this procedure. How does it feel for you when you are doing such a new procedure, such a groundbreaking procedure?
Well, I think for everybody involved, not just me, but for the theatre team and the nurses on the ward and everybody, it's, we always take these things really seriously. So we have to think about it. We have to go and learn from people who are doing it. It was started in Europe. And so there are centres in Europe which have been doing it for longer. And so obviously I had to go through a training procedure. But, I'm very experienced. I've done an awful lot of anti-reflux operations. And as I said, that's what we kind of specialize in. So reflux stop is a development of some of those. So a lot of what I was doing, although you put them all together, it's a new thing, but the various elements of it are things that we are, relatively, we know what we're doing. We like to think. But yeah, I mean, you always have to think very carefully about who you're doing the surgery on. Patients clearly need to understand they are going through a new procedure. And so inevitably there are going to be a few more risks. We do know actually that if you look at published data from around the world, from the UK as well, that the more operations, the more experience people have got, then their outcomes are better. If you go to places where they do a handful a year, then they tend to get more problems afterwards than if you go to specialist centres. So we were pretty confident we were doing the right thing. Bradley was pretty confident that's what he wanted. And so at the end of the day, we were prepared. But you're quite right. It's always a great relief at the end of the day when it's gone well. And it's even better to hear a few weeks later when you hear that it's worked out as everybody hoped.
Well, you mentioned there, about the survey that you did about how he was feeling now and how it had completely changed his life. You did. You completely changed his life. And just have a listen to this. I asked him earlier what he would say to you.
Thank you very much. He's changed my life completely, and that's all I can say is thank you.
How does it feel when you hear that real emotional, mental impact that you've had on someone?
Well, it's a privilege to do what we do at the end of the day, Joe. It is, there's a lot of bad press about doctors and medicine and the NHS at the moment. But ultimately, at the end of the day, having the opportunity to be given the privilege of somebody to put a knife in them and operate them is always a massive privilege. And that's what we're about. That's what we want to achieve. And usually it does work out pretty well. It's just fantastic to hear that Bradley put his trust in me. He put his trust in Reflux UK and in the hospital, the King Edward VII, where the surgery was performed, and everybody who works there. So, it's just very, very gratifying. And sadly, the problem is in the UK, there aren't more people who get the opportunity. If I was to tell you that just 1% it's thought of patients who could benefit from the kind of surgery that Bradley had are actually even offered the opportunity, it gives you an idea of just how many other people there are out there that could benefit.
Will that
change? And that's what we want to do.
Is this going to become more available on the NHS?
I can't answer that, to be absolutely honest. I think the NHS has got all sorts of priorities at the moment. And as I said earlier on, the sad truth is that the impact of reflux symptoms upon people's quality of life is underestimated and is often not a priority. But, it's not just quality of life. Gastro Oesophageal Reflux Disease is the cause of the majority of esophageal cancer in the UK. So there are several thousand people a year in the UK who develop cancer because of reflux. So it is a serious condition. And in my view, it's the one that should have a high priority. So, that's what we want to do. We want to get the word out there. We want to let people know that there are lots of new options for its treatment. Reflux stop is one of those. And, the final thing just to say is this isn't all about surgery. Surgery can be fantastic for the right people, but probably 85% of people that we see do not end up getting an operation. We can find other ways to help them to make the right diagnosis and to find other treatments which will benefit them. And so that's the key thing. The key thing is getting access to the right people, and then hopefully you've got the best opportunity of getting the right outcome.
Well, it's been fascinating to talk to you and Bradley today, so thank you so much for your time. There you go. That was Nick Boyle, the man who performed the surgery on Bradley, who we heard earlier, whose life has just been transformed after suffering with this incredible heartburn and acid reflux for decades. It's an incredible story.